All right, today I'm going to answer all your questions about all things Social Security, retirement, working while receiving Social Security benefits, spouse benefits, survivor benefits, working and while receiving disability, Medicare, Medicaid. So make sure you type your questions in the chat and I will get to as many as I possibly can. Looks like we already got a bunch in there, so let's just not stop the stalling and get started. Okay, Rick asks spousal benefit question. My wife has been a stay at home mom and does not have enough quarters for her own benefits. Can she draw spousal benefits after I retire and plan to retire at 70? Yes, 100%. Because she is not entitled to benefits on her own record. She will have to wait for you to file benefits on your record first in order to get those spouse benefits. So what happens is if you retire at 70, then she won't be able to start her benefits, her spousal benefits until you start yours. So you call up Social Security, file your claim, and then you hand the phone over to her, and then she files a spouse claim on your record. She does not have to be insured at all. A lot of people miss that, so thank you for asking that question. If she was insured even just a little bit, she paid her 10 years, 40 quarters. What a lot of people do is they do a split strategy where the lower income spouse goes ahead and starts those benefits and then just waits for the higher earning spouse to start those benefits later. And if the spouse waits until their full retirement age, they will receive a full 50%. Same situation with you. If you start your benefits, if she is her full retirement age at that time, she will receive exactly 50% of your benefit amount. Can Trump cut my disability benefits? He said he's not going to touch Social Security. He's not going to raise the retirement age. But his prior administration, he, as part of his presidential budgets, he tried for 4 years to make it more difficult to get disability benefits, to make it more difficult to keep disability benefits. And Medicaid, as you probably saw on the news, is on the chopping block, but that's not on the chopping block. And so we're getting kind of mixed messages there. The system is down, all kinds of crazy stuff happening. But Medicaid is definitely might be issues going forward here. Medicare, we'll see what's going on. I'm keeping up on all of these new developments, so make sure you subscribe and I'll keep up on that. But as of right now, it doesn't look like your disability benefits, as far as I can tell right now, there's nothing in law, there's nothing passed Congress or signed by the president, but there is an attempt to make it more difficult. And the process, the CDRs. If you're currently receiving disability benefits, and your time is approaching, the 1 year mark or 3 mark or 7 year mark for for CDRs, the continuing disability reviews, then maybe the regulations might be more stringent at that time. But I will keep you in the loop if I see anything. I began collecting Social Security at my full retirement age in 2023. Husband waited. All right, got cut off there. So let's move on to the next one. I was just approved for my SSDI last week. Congratulations. Waited almost 8 months. Oh, that's pretty good nowadays, considering Social Security is a 50-year low in terms of staffing, and it's taken 6 to 9 months. So you're about average-ish. I was also approved for my Medicare. I'm 64 years old, birthday in March. I don't need Medicare right now. I'm covered under my wife's. Okay, perfect. So they will sign you up for Medicare Part A automatically, and it's zero premium. So if you start receiving Social Security benefits and you're eligible, you have to take Part A. So you're kind of stuck there. Part B, you can go ahead and refuse. When they send you your Medicare card in the mail directly from Medicare, make sure you don't throw it away. We got 11,000 people turning 65 every day. It's the part of the silver tsunami, and they're being inundated with Medicare stuff, particularly when you turn 65. And unfortunately, some people, they get so much junk mail, they just throw anything away that says Medicare. And sometimes people are throwing away their actual stuff from Medicare with their Medicare number and everything. So make sure you don't do that. But when you receive it, you'll see instructions on there and how to refuse Part B, so you're not charged the $185. And then, as long as you're covered by your wife's work, as long as her employer, her group health plan has 20 or more employees, and you're happy with that plan, it doesn't cost you an arm and a leg, and they don't force you to sign up for a Medicare, then you're good. Um, the only caution is if you because you're going to be enrolled in Part A, if you are contributing to an HSA, a health savings account, you have to stop contributing to that. You can still use those funds, you just can't contribute to it anymore. Considering all that has happened today, I'm terrified at what is heading towards us like a freight train. Yeah, there's going to be a lot of stuff. And, before the election, there was, oh, no, Project 2025 has nothing to do with the president. But it's all coming to fruition. Yeah, the guy in charge of sending out that letter last night talking about um, freezing all financial assistance. He was one of the authors of Project 2025. So that whole thing about it not being part of is was guess what? Um, I'm trying to stay neutral here. I'm a disabled vet. I'm not doing a very good job, am I? I am a disabled vet. I draw a VA disability at 100% rate. Can I draw a Social Security disability, or should I just draw my regular SSI? SSI is the welfare-based program. Um, and so, yeah, if you're 72 years old, you cannot file for disability anyway. There's no such thing as Social Security disability after your full retirement age. Nobody in the country receives disability after their full retirement age. Everybody has switched to regular Social Security. And that's what you're talking about, I'm sure, is just regular Social Security. And I hate to break the news to you, but if you haven't already started your Social Security retirement benefits, then you just lost a couple of years of benefits because your benefits don't increase after 70 years old. So at the very, very latest, people should start their Social Security benefits at 70 years old. No, not a day later. So unfortunately, if you haven't started your retirement benefits, then yeah. Well, one of the good things is you can ask for 6 months of retroactivity. So call Social Security immediately. It's at the end of the month now. So if you call before the end of the month, even if you can't get through, take a snapshot of your phone or something like that you actually tried to get through. And that way, when you do get through later, if it's the next month, you can actually start your benefits, when you first attempt it. It's called protective filing. It's one of those insider tricks that our community gets here. So, and then once you start your benefits, ask them for at least 6 months of retroactivity. Even more, if let's say you called Social Security a year ago and you couldn't get through or something like that, then I would make the argument. I would tell them, says, "Hey, I tried to call y'all like 6 months ago, a year ago, or something like that, but I was given the wrong information, or I couldn't get through, or whatever, whatever, whatever." And your attempt should be to try to get as much back pay as possible. Yeah. Let's see. My last employer, by a labor contract, still donates to HSA for the rest of my life, for cover Medicare mostly. And the second, can I use this to pay my Medicare premiums? Yes, you can use an HSA to pay for your Medicare Part B, Part D premiums. You can't use it to pay for your Medicare supplement, but that's kind of out of my wheelhouse because it's the HSA. Um, it exists for IRS tax reasons. So I would contact your tax person and make sure they check out what the IRS says this year of whether you can use it. My understanding is you can use it for Medicare premiums and original Medicare Part B and D and all the rest of it, but you can't use it for a Medicare supplement plan. But you know, so I'd reach out to your tax person. I'm a 70-year-old vet. Okay, all right. Let me see. I already had that one. Take and took. What's up? Definitely some people confused too. Are waiting on tomorrow's live stream chat. I posted a message there trying to direct them by telling them to go to the live tab and pick the second video. Okay, perfect. Thank you. Take and took. Let's see. I've been collecting my spousal benefits this month. Social Security is using my husband's full retirement age from 2020, but my 2025 payment for their calculation. Why do they use my current fraud payment, which includes COA, change of address, COLA? All right. You began collecting your spousal benefits. Yeah. So they will use the full retirement age calculation. They'll update it for COLA. Yeah. All benefits are updated for COLA. So, the estimates on online, they don't, future projections, they don't add COLA because they don't know what it is in the future. But yeah, all benefits include COLA increases. What is the difference in benefits for disabled divorced spouse and divorced spouse with not enough credits claiming benefits on retired ex earnings credit? Okay, there is no disabled divorced spouse benefits. The closest possibly you might be talking about is called a DWIB, disabled widows benefits. But your ex has to be deceased, or actually your recent spouse. So yeah, in for all other disability, you have to get disability on your own work record. The only time you can get disability on another person's work record is the disabled widows benefits, or a child that became disabled before the age of 22 can get those benefits on a parent's record. But yeah, if you don't have enough credits on your own work record, you didn't have the 40 quarters, 10 years, and all that kind of stuff, no problem. You can collect benefits on a previous spouse if you were married to that person for 10 years or longer and you're not currently married and all the rest of it. Yep, no problem. My client is divorcing. Spouse's income benefits much higher. How long after divorce can he get her bennies? If they were married for 10 years, they immediately. If she was receiving benefits at that time and then they get divorced, then the benefits stop unless you can immediately be entitled to those benefits based on a 10-year marriage. So, yeah, as long as you have the 10-year marriage, you are good. Can you explain the family maximum and do both parents and DAC all count to the maximum? Okay, that's a short question, but a very involved one, because you're talking combined family max. Okay, so a family max is, let's say a parent is receiving retirement or disability benefits. There's a maximum that can be paid out on that person's record. So they take what they're paying on their, receiving from their own record, and if they have one or two or three kids, or a child in care benefit or something like that, then there's a calculation that they do, and it's different for survivor and disability and all the rest. And so they determine how much it is. But when you have a combined family max and you have children receiving benefits from both parents, then they can, as the name implies, they can combine a family max. So they can give part on one and part on the other. And that gets that gets a lot more complicated. But luckily for Social Security employees, the computer system does all that for them. So they just put in the claim and say, hey, this person is entitled, this child is entitled on two records, the parent, both parents, and the computer system automatically calculates the combined family max. And it is a fun one. Let's see. Applying for SSI will affect green card sponsor and tax issues for sponsor. She is living with sponsor and no income for her. Yeah, generally, if you sponsor someone, you tell the government, the INS, whoever, that person will not be, dependent on, financial assistance from the taxpayers for 5 years. So yes, you have to make sure you abide by that. Dr. Ed, what panic is going on about Medicaid, Medicare, and SNAP and all federal funding cut and froze by 5 p.m.? People are panic and it's chaotic. Yes, I was going to do a video on that. I might do one on a little short one, but I'll give you a kind of a heads up. Yeah, the way they wrote the Office of Management and Budget, even the head guy, Vote, didn't do it himself. He had his assistant do it. So I think that's, possibly throwing the poor guy under the bus. But yeah, they just wrote it so vague that they're going to cut off all kind of financial assistance. But the only qualification they put in the two-page, order was it's not about Social Security or Medicare, but didn't mention anything else. And yes, people are freaking out about Medicaid and food stamps and Section 8 housing and all that stuff. And so um, the White House spokesman came out today and kind of clarified it a little bit, and said it doesn't affect those particular programs. But is this just a trial balloon? Because there are there they are the Congress, the 119th Congress is now meeting in not Mar-a-Lago, another one of the golf courses that Trump owns. And they are meeting down there and coming up with a plan of attack. And I'm keeping an eye on that. I wish I was a fly on the wall there so I could give you all a heads up. But as soon as they come out with the proposals, but I'm sure it's going to be based on 2025 and the Republican National Committee study committee that we've already seen. I've gone through a few times. So, but I'll keep you abreast of actual things that are coming up. Question: Medicaid pays my Medicare premium and I have extra help. Does Trump freeze affect me? As of right now, no. But yeah, there's been a long attempt to go after Medicaid, and particularly do it is in the sense of, okay, we're not going after Medicaid, we're just making it more efficient, fraud, waste, and abuse, and adding work requirements. So there might be some work requirements, even though a vast majority of people that are receiving Medicaid health insurance, last numbers I've seen, either about close to 80% are 80% of those are either working, going to school, or taking care of someone that needs help. So it's not as though, there's obviously some people that just, can't do any of those. But yeah, I'm going to keep an eye on all that. But as of right now, that freeze does not affect you. 4 consecutive years, 2007 to 2010, income from my single member LLC isn't on my earnings record. Who am I? Though I am sure I paid FICA. How might I get that resolved? Contact the INS, the IRS, and you can. I think online you should be able to get one. It's actually called an IRS transcript that shows you actually paid it in there. You just basically take your tax returns down that prove that you actually paid FICA. So just grab those tax returns, get them from the IRS directly if necessary, take them down to Social Security, and it'll show that from what you say, it shows that you paid FICA. So doing a great job, doctor. Does Trump's freeze federal aid on federal agencies from last? Okay, thank you. Yep, I just talked about that. Yeah, I have to pay for those tax cuts for the billionaires. They really, really need that money. The freeze doesn't apply to individual benefits. Correct. That is correct. Federal judge temporarily halted Trump's Medicaid shutdown. Yeah, the and made it even worse. I guess the accident, as we used to say in the Marine Corps, accidentally on purpose, they shut down the funding website for state Medicaid. So all 50 states couldn't get into the Medicaid website that they use to administer Medicaid throughout the states, because Medicaid is a federal state partnership. Medicaid, we're not talking Medicare. Medicare is, what you sign up through Social Security, the Part A and the Part B and all that stuff. Medicaid is administered from the state, and that is for low income, low resource people for health insurance. And it's paid for by state and federal funding. So the states go into this program and get the money from the federal government and all the rest of it. But I guess the system was down, and accidentally on purpose. Yeah, we'll watch it. Yeah, a lot of questions. Does the president's freeze of all apply to pending applications for Social Security retirement benefits? Absolutely not. Yeah, that is one thing that two-page order was very clear on, is that it doesn't affect Social Security or Medicare. So no, nothing there for Social Security. So luckily, as of right now, not an issue. Thank you, doctor. My first interview with Social Security is tomorrow. I requested SSDI. Perfect. Make sure they treat you well. Make sure you have, you're filing for SSDI, Social Security Disability Insurance. Make sure you have your doctor's names, the addresses, the phone numbers, and all that kind of stuff, because they will ask you all that information, and they will contact those doctors, request your medical evidence directly, and they'll have you sign or verbally attest to, it's called authorization to release medical information. It's SSA 827 is the form. They'll have you attest to that verbally, and that's what they'll use, kind of a HIPAA type form, so they can get your medical records. You don't necessarily have to provide your medical records. So yeah, make sure they treat you right and are polite and efficient and all that kind of good stuff. If not, complain, or contact your congressperson. And sure, it took you forever to get an appointment. I just got approved for SSDI. Where on the award letter does it show how long before I get a review? Yeah, they used to provide those on award letters, but I guess they don't anymore. But you can contact them, um, and contact the DDS or your local Social Security office and ask them when you will get your CDR. But regular viewers to my channel know that FCF, CDRs, those continuing disability reviews, please don't stress them. Forget about it. Forget about it until you get it. When you get it, complete it. And then once you complete it and send it in and you keep your copies, then forget about it again, because it's all a budget type of issue. The Congress has to allocate a separate budget for those things. Sometimes they do, sometimes they don't. So that is not something you need to worry about. You need to worry about getting better and taking care of your health and all this other kind of stuff. So don't worry about the bureaucracy. When it happens, and just complete it. So. Doc, I need a one-on-one with you. How do I do that? Yep. I put the link in the top there. I do very, very, very limited. They're being more limited personal calls. I do charge for those to pay for the phones and the computer systems and all that kind of stuff. So 99% of my help is free. And Chapters help is free as always. So if you need help with finding a Medicare supplement plan, a Part D prescription drug plan, a Medicare Advantage plan, give them a call and they can help you out for free. And this is um, got a few more days in January. This is the Medicare open enrollment period. So if it turns out you signed up for the wrong Medicare Advantage plan, or you forgot to check your Medicare Advantage plan, a lot of plans were downgraded for 2025. So if you forgot to check, you still get one more chance. And if you do it within the next couple of days, by January 31st, your new plan will start February 1st. If you wait until February, then your new plan will start in March. So basically, this is the open enrollment period. You have January, February, and March where you can change one time your Medicare Advantage plan. So if nothing else, if you forgot to check your plan during the annual enrollment period from October 15th to December 7th, give them a call and they can check your plan and see if it's still the best for this year. And most importantly, this is also the time where you can get out of a Medicare Advantage plan and go back to original Medicare, and get a Medicare supplement, one of those Plan N or Plan G. But in most states, you have to pass health underwriting if you don't have some other type of special enrollment period. So if you're looking to get out of a Medicare Advantage and go back to original Medicare and a supplement, now is the time to do it. That is until March 31st. And then unless you have a special enrollment period or in a particular state, then you won't be able to do it until next year or the end of the year. Gladys, I just wanted to say thank you for the superb job of clarifying the Social Security program. You're welcome. You're doing an exceptional job explaining everything. I've shared info with family and friends. There we go. That's what I like to hear. Yeah, I appreciate that, number one, and we appreciate you reaching out to people and thinking about people more than yourself, other people. Yeah, great. Awesome. Thank you. When my husband passed, I was offered his or mine. I took his. What happened to mine? Yours is continuing to stay there. So it sounds like the Social Security employee that helped you out did an awesome job. So, in terms of survivor benefits, you can collect survivor benefits and you don't touch yours. So, you continue to get those survivor benefits, and it depends on how much the benefit is on your record, but maybe now, or the last time you should check is when you turn 70. Maybe those benefits went up more than your survivor benefits. So if you're not sure, then I would call Social Security and say, hey, are my benefits higher on my record? And if they are, then you switch from survivor benefits to benefits on your own record. So I'm going to be 65 in a couple of months. I have called about starting my benefits, have a March appointment. Daughter and I have LLC partnership. Will that cause me any problems? No, not necessarily. So you're going to start your benefits. Um, it- your money benefits, I assume 65. Anytime I hear 65, I think Medicare. But if you're going to start your money benefits, then you're under your full retirement age, so you have to limit the amount of money you make. And since you have a company, it's net income from business. So as long as you stay under the $23,400, then you can collect your Social Security benefits and nothing is withheld. And then because you're going to be 65, they're also going to ask you about Medicare. And do you want to sign up for Medicare, Part A and Part B, and then you have to figure out what you're going to do to cover all the gaps of original Medicare. There's a lot of financial gaps, and so Medicare supplements. Those are the ones I always recommend. Always, always, always check out a Medicare supplement, a Plan N or a Plan G first. Doesn't matter who you talk to, but you can reach out to Chapter. But always say, "Hey, tell me about Medicare supplements, Plan N and G." And if it's not right for you, usually it's not right because there is a monthly premium. It's a budget issue. And then if it's not right for you, then start checking out a Medicare Advantage. And then you have to make sure, you get as many doctors in the network as possible with that particular plan. You save as much money in terms of prescriptions and all the rest of it. So there's probably dozens and dozens and dozens of Medicare Advantage plans in your particular area. So you just have to find one that's right for you. But always start with a Medicare supplement. But if it's unfortunately 50%, 51%, last I've seen, sign up for Medicare Advantage. Usually it's because they don't know there's anything an option. There's another option, or it's a budget issue. But remember, it's a budget issue now. But if the Medicare Advantage, they kind of nickel and dime you and stuff, and if you actually get sick, then a Medicare Advantage might actually cost you more than even though it's a zero premium. But if you never get sick, if you live for the next 50 years and you never get sick and you just one day just shuffle off your mortal coil, then yeah, Medicare Advantage was definitely the way to go. But unfortunately, we do not have that crystal ball. Retiring in 2026, was in the military from 78 to 88. When I apply for Social Security, will it be bumped up a little for what I see online? Yeah, very, very little, but hey, it's your money. So just make sure when you apply, you tell them that, yes, you served in the military, and yep, they'll get in there. Trump is not trying to make it harder to receive benefits. He's just trying to make sure that the benefit goes to the people that actually deserve it. He was president for 4 years, and the decline of help from Social Security has been a steady decline for years and years and years. I mean, it's declining now, 50-year low. It declined under Biden. It declined under Trump when he was president. So it's more difficult because you paid for that help. All of those decades you paid into FICA, into Social Security and Medicare. Part of that was to go to say, okay, hey, when I turn 62 or 67, I want those benefits. And I want help to make sure I get the benefits I earned. And now you're not getting that help, even though you paid for it. And everybody's to blame. Biden, Trump, Obama, Clinton, Bush, every congressperson since the 1980s is 100% to blame for not doing the right thing. So there's that. Dennis, my wife is currently drawing spousal benefits on my account. She is a retired Texas teacher, but has not begun to draw her teacher's retirement. When she draws TDS, will Social Security be reduced? No, not anymore, because they signed the Social Security Fairness Act. So some people, I've saw some remarks on my YouTube about. I'm going to do an update on the Social Security Fairness Act this week. But some people are already getting the benefit of that when they go in to file for benefits. So if your wife went in to file for those benefits today, they really wouldn't even talk to her about that, and they would just give her her full benefit amount. So that act is already being processed now. But the problem is all the other millions of people that are going to get those extra benefits. Yeah, that's going to take a while, but it's already essentially happening now. Okay, I already answered that one. Just like, okay, he's just making sure benefits go to the people that actually deserve it. Yeah, there's nothing wrong with that. Yeah, there's nothing. Yeah, I'm 100% against efficiency and all that. That's why the new Social Security commissioner is kind of an efficiency guy, computer guy. but he's also a Wall Street guy. So hopefully he uses his efficiency hat and tries to make Social Security more efficient. Every organization in the world can be more efficient. Um, but hopefully he doesn't put on his Wall Street hat and tries to get our money and give it to him and his buddies. So, does an employer disability plan LTD have an impact on SSDI? No. Long term disability, short term disability from an employer does not have an effect on Social Security disability insurance. The only thing that does have an effect on Social Security disability insurance is like a workers' comp or a public disability, not a private thing. So, no. I want to know if I file for benefits on my ex husband's. He's retired. Will he know and will retirement checks be reduced? No, he will not know unless you tell him. And will his benefits be reduced? His new spouse, his new kids? No, he won't even know it, and it won't affect his benefits at all. So go get him. I started collecting my Social Security at 68. I am now 77. My wife collected 02 to the GPO. We have now filed for spousal. Will her amount be based on my current benefit? Yes. Yep. And you're going to get that year of retroactivity back to January of 2024. Yours is so you've now filed for spousal, so you recently filed for it. So good on you. Yeah, I just did a video on that. That a lot of people are going to be missing those benefits because they don't know they need to refile if they already are not in the system. So, like in your particular case, Russell, here's what I figure happened. You filed, your wife didn't even file because the person said, even if you file, you're not going to get anything because the GPO, the government pension offset's going to offset everything. You're going to get zero. So why file? So your wife probably didn't file. And those are the people that, unfortunately, I think there's going to be people that miss the benefits because what you need to do is exactly what you did is go file, and that way, she is protected. She is on your record when they update the system and release those benefits. So yes. Hi, curious if newly appointed Dr. Oz has been confirmed. What is his plan for Social Security? Yeah, he hasn't had the confirmation yet. I think the new commissioner of Social Security is in the next week or so. But yeah, Oz is he's not going to be in charge of Social Security. He's going to be in charge of CMS, the Center for Medicare and Medicaid Services. But he is a big fan of Medicare Advantage. And his plan was kind of Medicare Advantage for all. And whatever happens there, I will defer judgment. But if he attempts to do Medicare Advantage for all, then everybody knows the issues he needs to address is those prior authorizations and the declining networks. So yeah, I'm going to keep an eye on that for y'all. I have the same question as Leslie on only the opposite. I am consistently told by any and all extra help that I don't qualify because I own my home. Yeah, no, extra help, any type of those type of programs, SSI, extra help, Medicaid, food stamps, all of those things, they don't hold a house against you. If you have another house and another land or something like that, then they do your second, home or whatever. And so your home, and a one vehicle is exempt. I've had people that I've got one vehicle and then I've got another one on cinder blocks out in the front yard. I'm saying, well, sorry, that one's still registered in your name, so it actually counts. So it hasn't run since 1973. So yeah, found on road did. So yeah, it doesn't count against you. One home and one car doesn't count against you. Question: bartered housing, i.e., someone house sits for free in exchange for housing. Does the government consider that as income? Um, so no, unless we're talking about SSI, the welfare-based benefit. So if you're talking about regular retirement, survivor benefits, disability, no issue, you're good. If you're talking about SSI, up until last year, up until a few months ago, it did. Now it really doesn't in most circumstances. But it doesn't sound like you're talking about SSI, the welfare-based program. So if you are, then yeah, I would definitely reach out to an SSI claim specialist and have them check on the new law without specific case. I applied online in November and got a quick callback. I am 66 and was approved within 3 days. I'm in New York State. Your videos are on spot. Thank you so much. All right. Yeah, so you filed for retirement or disability benefits? Yeah. If you got approved in 3 days, then I'm sorry. My heart goes out to you. Because if it's disability, that means you have a terrible disability, and a lot of people don't understand that if, your disability is a terminal case, people get approved the same day for disability. But I'm hoping you just mean retirement, that you applied for retirement and did it within 3 days. So that's awesome. We like to hear that. Good job, New York office, whatever office took yours. Awesome. Can you get SSI and SSDI at the same time? Yes, you can. So SSDI is based on disability, and SSI is also based on disability. People that are aged can also get it too, 65 and older. But if yes, how it works is, let's say your SSDI, your benefit from SSDI is only $500, and you don't have any other income or resources to speak of, then what happens is they can give you SSI, the supplemental security income, for kind of the difference. And the max this year for SSI is $967. So basically, you receive $500 from SSDI and the other $467 from $500 from SSDI and the other $467 from SSI. Yeah. And then if you do get the SSI, remember, you're in most states, you're called categorically eligible. So you can go down to the state and get Medicaid. Um, if you're on SSDI, then you're eligible for Medicare. So you become dual eligible. You can have Medicaid and Medicare, and that's something that I am watching in the future here, because I think a lot of people are going to be jammed up, because they're dual eligible. There's millions of people that are receiving SSI Medicare and Medicaid, and if their Medicaid ends because of funding or whatever the case may be, then they're going to lose that $185 that Medicaid has been paying to Medicare for the Medicare Part B premium. And a lot of people says, "Well, I just can't afford $185," and so they're going to cancel Medicare, and then they're going to be whipped. They're going to really be up have a hard time with health. So hopefully that doesn't happen. If you have Medicare and Medicaid, you're also eligible for those Medicare Advantage dual eligible plans. And this is one time I do recommend Medicare Advantage dual, and Medicare Advantage is when you have Medicare and Medicaid. There are some exceptions. If you're receiving like home health care or something like that, I would check with your home health care people that come out to your office, out to your home on a regular basis. And sometimes those companies don't like dealing with Medicare Advantage plans. So they like dealing with Medicaid directly because Medicaid pays quicker and more, I guess. It depends on your state. So reach out to them. And that is if you're getting help, people coming out to your house to take care of you. But if not, then yeah, Medicare, you got Medicare, Medicaid, you get a Medicare Advantage dual eligible plan. And those are the ones you see, with the kind of the scammy advertising about, those food grocery cards, but they do exist. They're just advertised really in a not a nice way, that I don't like the way they're advertised by some people out there. But they do exist. Depends on your particular area. You can reach out to chapter and they can see if one of those is available in your particular neck of the woods. Joe, I'm 54, disabled. How will this help or not help me? If you're disabled, and Social Security defines disability as the inability to work, if you are not able to work because of your disability and your disability is going to last 12 months or longer, I would 100% file for Social Security disability benefits. Yes, absolutely. And the sooner the better, because it takes forever to get a decision. So. April, I'm collecting Social Security. I'm 63. My ex is under 60 years old, and he's going to get SSDI. Will I begin to receive a percentage of his SSDI? Yeah, if he's receiving benefits, you just might be eligible for benefits on his record. So once he's approved for SSDI, reach out to Social Security and see if there's any money there for you. Absolutely. Jody, is it possible to get disability for non-Hodgkin's lymphoma, fibromyalgia, and it people ask me that all the time. I'm a doctor, but I'm not that kind of a doctor. That's why I put my full name as Dr. Ed Weir, PhD. So people say, you're not supposed to put both. And I'm like, I just want to make sure people, because people call me Dr. Ed. And so I just want to make sure people don't think I'm a doctor, medical doctor. Um, So if that, whatever your disability is, if it keeps you from working, then file. So some people say, well, I've got this, and is it, is that qualify? And you say, well, I don't know. But, and then they say, oh, yeah, yeah, because of this, I have to take these pills. And because I take these pills, I have to go to the bathroom 20 times a day. It's like, who's going to hire you? Anybody can get a job. Pretty much anybody can get a job online or stuff like that. Whether you can keep that job for more than an hour a day or a week or a month, that's a whole different question, right? But if you're going to the bathroom 20 times a day while work, then yeah, you're not going to keep that job very long. So yeah, if those conditions keep you from working, please apply. OPM put out, OMB, the Office of Management and Budget, put out a memo today trying to clarify that this is federal aid freeze is not supposed to be affecting Medicare, Medicaid, or Social Security. But I'm not sure if it's actually working out that way. Yeah, yeah, they did a bad job freaking people out, and possibly that was the reason. They anyway. So flood the zone, just massive amounts of information, and then people are just kind of freaking out, and their eyes glaze over, and then the powers that can be that do the stuff they want to do, but they just kind of confuse everybody. So flood the zone. Thank you. I'm 62, going to start taking SSI. My SSI is welfare, so you're probably going to talk about regular Social Security. So you're going to start taking regular Social Security. My wife is 5 years younger. Will I be penalized if I start mine now and then take her spousal benefits when I am 67 and she's 62? No, your spousal benefits are calculated when you start those benefits, and you can start those benefits when she starts her benefits. If you are your full retirement age at that time, you will receive 50% of her full benefit amount. Your portion of the benefit will always be reduced, but you'll receive 50% of her benefit amount. So I'm worried that Social Security will be cut off from everyone, including myself. I'm 68 and collecting my retirement and working part time. I was hoping to retire altogether next month. Yeah, it's there. We've known about this for decades. We've known about the impending cuts that the trust fund is running out last, or not last year. It's the year before now. In 2023, $70 billion was taken out of essentially our trust fund Social Security savings and given in your people's checks. For 2024, the numbers aren't out yet, but it's probably going to be another 70, $100 billion. And that savings, just like when you go into retirement, you reduce your earnings, but you got a nice little savings, and you're hoping your savings will last you until. And that's the same thing with Social Security. It's receiving X amount of money coming in, and there's a shortage, but no problem. We've got a savings, the trust fund. They're pulling money out of the trust fund and giving it to people. But the problem is the trust fund is slowly diminishing, and estimates are that it's going to run out in 2033 or 2032, 2034. And and so benefits have to be cut at that time. We've had decades to fix it, and we and our politicians haven't done it. And yeah, we kind of painted ourselves into a corner, haven't we? So hit the like button. Yes, please hit the like button. This is how we get this information out to more people so they get the benefits they need. I'm getting spousal benefits because his was higher than mine. I first received on my retirement. We were divorced, and he passed away since my filing on mine. I am not getting 100% of his. So yeah, for survivor benefits, there's different calculations. If you were your full retirement age when that happened, then you'll get 100% of his benefit amount. But his benefit amount might have been reduced because he took it early. Yeah, so it really depends on how old he was when he took his benefits, and how old you were when you started those survivor benefits. Thank you so much for your regular live chats. You're welcome. Is it okay to receive Social Security and IRA distributions at the same time? Yes. If you're talking about just regular retirement benefits or spouse benefits, yep, IRA distributions, no relevance to Social Security at all. The only time it does is when you're receiving the welfare part, the SSI. But if you're just receiving regular retirement, yep, no problem whatsoever. Guy named FDR, Franklin Delano Roosevelt, in 1935, says this is, a three-legged stool. You got your pension, which, not many of those anymore. You got your pension, you got your savings, and you got Social Security. So your savings are, your IRA and all the 401k and stuff like that. So nope, the one does not affect the other. Let's see. I'm jumping around here. Got a lot of questions. Donald, my benefits are split into two payments. I get a payments on the first and the third, which total $963. I'm 65 and in September turned 66. What that means for me? All right. Yeah. So you're getting two payments. So it really depends what the nature of those two payments are. It sounds like probably one of them is SSI. Um, so yeah, the SSI check comes on one day, and then your disability benefits come on another day, or your retirement benefits come on another day. Yeah. So, but when you turn your full retirement age, it's probably you're still going to continue getting benefits at the same time. So, unless the type of benefits changes, which it doesn't sound like it will. If I retire in June and get my first check in July, when does the first year rule about making a limit amount of money start? June or July? Starts in June, because you'll get you're entitled to benefits in June. It's just that your June check doesn't come until July. So starting in June, you have to stay under the $1,950 going forward. So Elaine, we are currently in a government freeze. What now? $3 trillion cut. Will this affect my 95-year-old mother who will need a nursing home since her income care is stopped under this freeze? Wow, her nursing home care is stopped. It's under the freeze. Yeah, hope it's not supposed to, but they said direct payments to individuals. But if this is a payment to not an individual, but does some type of, yeah, that's yeah, I'm not sure about your mother there, but it certainly shouldn't. Her nursing home, because she'll continue to get Social Security benefits and continue to get Medicare. The memo specifically, said those are not being affected. So her nursing home is probably being paid by that, unless it's also being paid by Medicaid. And they just came out and they said Medicaid for now is not affected. So yeah, reach out to your politicians and impress upon them the importance of not messing around with that stuff, because that's people's lives. Vic and Cynthia, can I stop a medical insurance late enrollment penalty that wasn't my fault? You can certainly try. With the government, you can always try an appeal. So if you're getting the late penalty for Part B, which it sounds like you're talking about, yeah, I'm going to see a lot of this going forward, because Social Security is so understaffed and people are going to be charged penalties when they're not supposed to. So if that's your case, if then file an appeal, an SSA 561. It's a request for reconsideration, and say, hey, I shouldn't be paying this penalty because y'all messed up. I tried to contact you, you didn't have enough staff to process the paperwork in time and all that kind of stuff. So, and then you reach out to your politician and say, hey, you know, we need better customer service, and you need to support your local Social Security office. All right, I'm disabled, going to be 62 in May. My soon to be ex husband is 5 years younger than me. He is 50% disabled through the VA, but still works. Could I get his Social Security when we divorce? No, because he has to be receiving Social Security benefits, and he's receiving VA, and that's not Social Security. If he applies and is approved for disability, he just might. I retired 12/23. I worked for the federal government and I kept my Blue Cross Blue Shield. I have Medicare Part A. Do I have 8 months before I have secure Part B? If you are receiving federal employee health benefits, you don't have to technically sign up for Part B unless you're a post office or something. But I would reach out to OPM. Yeah, good luck getting through there too, right? They're really being, under, yeah, anyway, they're having a fun time, let's say. So I would reach out to them and see if you're mandated to sign up for Part B, and call up Blue Cross Blue Shield. Sometimes these companies, they want you to sign up for Part B because it benefits them, so they can save money, and then they say put that some of the savings on you and stuff like that. So I'll reach out to them. But normally, unless you're in the post office, you don't have to. When does your Medicare kick in on SSDI? Is it the date of you're considered disabled or when? Yeah, basically 2 years from when your benefits start. And, you have the 5-month waiting period and all that stuff. So, yeah, a lot of people don't, "Well, I don't know when it started. Did it start this month or was that the month, it was approved and it was actually backdated?" And so, yeah, the best way to do is just call Social Security and say, "Hey, when's my Medicare gonna start?" So all right, let's see. Another channel. Okay, let's see what's out there in social media land. Has a headline that's premiering tonight. New federal program to end disability benefits. Do you know what this is about? Apologies if you already talked about it. No, new federal program to end disability benefits. Yeah, sounds. I'd be. I mean, for SSDI, there is. There's a lot of plans in the works to make it more difficult to get disability benefits and to continue to receive disability benefits, but there's nothing out there that I've seen that is going to wipe out disability benefits, completely. But yeah, I keep an eye on that social media stuff, and when people go out there and they talk about some stuff that's not true, I try to correct it. I'm below the full retirement age, but continue to work. Benefits suspended last year for 5 months, suspended again this January. But I have since lost my job. What process for unsuspending? Just a work report. Call up Social Security and you do a work report. And because what happens is they think you're going to make the same amount you did last year. So that's why they're doing it again this year until you tell them differently. So you call them up and say, yeah, I made too much last year, but this year I'm going to be under the $23,400 and they will restart your benefits. So, and then when you're on the phone for 3 hours waiting to tell them that, open up your laptop, contact your congressperson and say, "Hey, why am I waiting 3 hours to talk to someone that's supposed to be helping me out?" Because they don't have enough staff and because Congress refuses to give them resources to, anyway. Karen, my daughter's almost 40. She became disabled around 30 years old. She gets disability. My very first husband, I was only married for 9 years. Can my daughter has one and only get his Social Security? Um, no, it doesn't. The way you wrote it here, it doesn't sound like it. But because in order to get benefits from a parent's record, that child has to, the adult child has to be determined to be disabled before the age of 22. So if she became disabled later after the age of 22, then no. But if she was disabled before the age of 22, then definitely a possibility. What happened to everyone back to the office? Guess it doesn't apply to them. Yeah, there was they're going to be sending people back to the office, which okay, fine, that's fine. But it's going to make customer service worse because I know a lot of people that would they're close to retirement and they've moved and they don't want to commute anymore, so they figure, oh, all right, I'm done and all the assaults. So Social Security is going to lose a lot of employees, and customer service is going to get worse. So, you want to send people back to the office, fine. People who were in the office since 1935, it's not that big of a deal, but don't delude yourself that it's going to improve customer service. It's not. Politicians say that's the silver bullet for customer service. It's going to reduce wait times and all this kind. No, it's not. And politicians know that. The reason customer service of Social Security sucks is because politicians refuse to support Social Security because they want customer service to suck. That is their plan, and they're doing a phenomenal job. They're very successful at, you know, destroying customer service. Those who are jobless and homeless need to apply for Medicaid or whatever they call in their state. Yes, 100%. If you're jobless and homeless and you're having a tough time of it, that's why those programs are there. Social safety net, Medicaid, food stamps, Section 8, which is an entire nightmare in and of itself. There's not enough out there. Yeah, whatever you can do. Yes, absolutely. Harley Girl, I just turned 65. I am drawing widow's benefits and disability. Do I call them and just go to widow survivor benefits and get the 98%? No, if you're receiving it sounds like if nothing changes, then you're good where you are, and unless you want to go back to work and stop receiving disability benefits. But no, once you turn your full retirement age, which probably sounds for you like at 67, what will happen is you'll continue to get widow's benefits, but your disability benefits will stop, but they'll just be switched to from disability to retirement benefits. So once you hit your full retirement age, you will get retirement benefits and widow's benefits, surviving spouse benefits together. The one offsets the other, but and remember, because you just turned 65, you have that golden opportunity to switch from a Medicare Advantage plan, which is probably the ones you got, or the one you got. In most states, that's the only thing you can get under 65. So now is a golden, you possibly your one only opportunity to see if a Medicare supplement might be better for you. So you can call Chapter, and they'll go through what the difference is between a Plan N and a Plan G. And if it's not right for you, at least you checked it out at your one time you can check it out. Again, depending on your state and stuff like that. But most times, yeah, 65, they can't deny you for health reasons. They can't charge you extra for health reasons when you turn 65. So, Ma tried to get Medicare to pay them last night. Payment bounced. Yeah, not sure. Ma tried to get Medicare to pay them. Okay. Medicare or Medicaid. Yeah. Are you saying that after you reach FRA, you can make as much as you want? Yes, absolutely. After you reach FRA, in terms of Social Security, yeah, you can make $1 billion a month, and Social Security doesn't care anymore. You'll might have to pay an extra premium for Part B and Part D, and I'm sure the IRS will want a chunk of that, unless you make $1 billion a month and then you don't pay taxes, right? So there's that. Anyway, where can I find the details of how my Social Security benefits were previously reduced under WEP GPO? Yeah, Social Security website. I'm surprised that all of the organizations that push that Social Security Fairness Act never told people how it was calculated. I think that was a conscious decision. Yeah, so that was anyway. I literally freaked out every day worrying about my last CDR. Yeah, please don't worry about it. Just, when you get it done, send it in, forget about it. Yeah, please. It's just it's a budget issue. You don't need to worry about, congressional budgeting and allocations, and just, get on with your life. The freeze was absolutely clarified. Any direct payments to citizens will not be affected. That includes Social Security, Medicare, Medicaid. Shameful of you to not clarify this, Ed. I did clarify that. Yep, three times already. My husband, 72, worked for the FRB, retirement, federal, right? FRB, Federal Reserve Board. Okay, acronyms. Let's say Federal Reserve Board, and could not get Social Security benefits. With the windfall, he should correct. He paid his 40 quarters and or is eligible to receive spousal benefits. Yeah, with the Social Security Fairness Act, they might, yeah, you might be eligible for benefits, and they're working through that right now. And I'm going to do an update on that. I'm going to go through the Social Security website on their new announcements, and I will translate that into English for you. All right, let's see if we got hundreds of questions here, and unfortunately, I'm not going to be able to answer them all. Let me jump around and people I don't recognize. Unstoppable Warrior. I moved from Ohio to Georgia. I only have Medicare now because of my move. Have to pay a high. I was denied the QMB, Qualified Medicare Beneficiary. Do you know any other programs that can help me with my Part B premium? Yeah, the other program is Medicare Advantage Part B Give Back. So the government, CMS, allows these health insurance companies to pay for part of your Part B premium. So they're called Medicare Advantage Part B Give Back, and you can reach out to Chapter, and they can see if there's one available in your area, and it might pay $50 or $100 or $185. But be careful of those, because these health insurance companies don't get to be billion-dollar health insurance companies being dumb and giving out free money, right? What they do is, if you got a regular plan that doesn't pay for part of your Part B and one that does, then what happens is, this one, if you actually get sick, you have to pay more. If you go to the hospital, you pay $300 a night, but this one, $100 a night. If you get an MRI, you pay $500. This one, maybe, $100, So I'm just kind of making stuff up. But yes, so the health insurance company wants to make sure they get their money back. So they will charge you more. So if you're sick, it might be a good idea to just get a regular plan that covers more. But if you just want to avoid, if you're relatively healthy and want to save money, then yes, reach out to chapter and they can help you out. All right, let's go for one or two more and then we'll call it a night. Are people on disability and Medicaid receiving any extra help? Yeah, Medicaid in and of itself is extra help. And then if you have disability, you can get Social Security disability benefits. You can get Medicaid. If you have Medicaid, you can get that Medicare savings program, the one that pays for your $185, like the previous question. They were paying for his $185. You can get the extra help with prescription drugs. You sign up through that through the Social Security Administration. If you got the dual, the Medicare and Medicaid, you can get the dual eligible, the Medicare Advantage dual eligible plan. And with the extra grocery cards and maybe some transportation and whatever is available in your area. So, all right. I think that is it. We are over an hour there, so we'll call it a night. I apologize to everybody. I couldn't get to your questions, but I will be back again tomorrow. And we're going to have a special. We've got a couple of people from chapter answering all questions on Medicare. So if you have specific Medicare questions, make sure you join me tomorrow.